Hello, viewers. Thank you so much for always being with me. Like I've always been passionate about health. Your health is your key to everything. If you don't have good health, you are not able to do anything in the world. So I'm very passionate. As part of my teachings, I bring you health tips that is going to help you and I also bring you traveling stuffs, immigration things in relation to health. I also bring you a little bit of politics. I also bring you a little bit of sport and everything. I'm very dynamic because hey, that is all health is about. You should not be stagnant. Health is all about also being dynamic. So today, as you viewers help me to realize that I have to teach people about a disease that is a silent thief of their sight. It slowly steals your sight. It makes you go blind slowly without you even realizing it. And which disease am I talking about here? It's no other disease than glaucoma. Glaucoma. What is it? I am going to teach you what glaucoma is. We are going to learn about what causes it. What are you supposed to do? What are you looking out for in order to say that somebody is even having glaucoma symptoms? We are not doctors, so definitely we are not going to decide until the patient walks in and get diagnosed with it. We will not decide for the patient, but we can tell the patient the signs and symptoms that people go through. Glaucoma simply means a damage to your optic nerves. Now, optic nerves are the corner here of your eye, okay? There are a bunch of nerve fibers forming there, and these nerves all meet at one and form the optic nerve, which connects straight to the brain. So when the retina, which is also a part of your eye, I am not going to go much into the medical terms of the eye because my video is purposely given to those who are not medical people so that we all learn. Okay, so if I use those terms too high, you will not understand. But retina is simply the part of the eye that vision strikes on it. So in a simple put, so when you view something and it strikes on your retina, it goes through the optic nerves, through the visual processing center, straight to the brain, and the brain will interpret whatever you are seeing for you. When this optic nerve is damaged, that is what causes glaucoma? Not really. I mean, anytime there is glaucoma, there is an optic nerve damage. Yes, that is it. But what causes this optic nerve to get damaged? People are saying that intraocular pressure is the only thing that can cause the optic nerve to get damaged. No, not like that. Somebody can have a high intraocular pressure and might still not have glaucoma, and somebody can even have low and will still have glaucoma, and that is what we call the normal tension glaucoma, because your intraocular pressure seems to be, or it doesn't even seem, it's within the normal range, which is 10 to 21 millimeters of mercury, which is very normal, but you have had glaucoma. So it's good to manage the pressure on your eye very well. In most cases, most glaucoma is associated to that, but not in all cases. Okay, so monitor the pressure on your eye, and the pressure on your eye, what can even cause this pressure to be on your eye? Well, race can play a role, black, white, Hispanic, whatever. So different race can play a huge role. Most black race or African race are at higher risk of developing higher intraocular pressure. Age can also play a huge role. As you age, the pressure tends to increase, so it can create a role. And also, studies have also shown that depending on the kind of work you do, people strain their eye a lot. People work a lot overnight and they don't have enough sleep. People also sit by devices a lot, and they don't take their eyes off screens, and they don't have any protective lens whilst they are on the screen. They can develop high intraocular pressure on their eye. Some medications can put pressure on the eye. Some food can also put pressure on the eye. So many other factors can cause this eye pressure to increase. But anytime that the eye pressure increases, it does not necessarily mean that you have glaucoma. However, most glaucoma cases have been associated with high intraocular pressure. But there is the normal tension glaucoma, which the person recorded a pressure within the normal range, yet the person has glaucoma. So as a nurse, what are you supposed to look out for your patient who has glaucoma? Well, I'm going to start by saying that if I am the nurse and my patient has glaucoma, I am going to first start with the education, and the education is what I'm doing with you right now. So I'm going to help my patient to know what glaucoma is, and like I explained earlier, I'll help my patient to know that there are nerves right here, and that nerves are connected straight to the brain, and that is what picks up vision and then sends it. That is what vision strikes on. It connects the retina through the visual processing center to the brain. And for that reason, peripheral, when that nerve is damaged, your vision is slowly going to decline, and eventually blindness will set in. So we should take good care of that nerve. And how you can take good care of the nerve in order to prevent it from damaging, one of it is what I have talked about, by constantly monitoring your eye pressure. So you go to the hospital, not the general hospital, specifically the ophthalmologist, the eye clinic, and you have them check the pressure on your eye for you frequently, and they will give you the necessary advice from there. Also, if I'm a nurse, I'm also going to educate my patient on the signs and symptoms of this glaucoma. So what are some of the signs and symptoms of this glaucoma? Well, when somebody has glaucoma, the person's peripheral vision will slow down and eventually it will be lost. The person will not have good vision at the peripheral level, like side to side, so we'll be seeing things double, and then eventually it's getting that bad, and then you go that short, And when you have the high eye pressure, you are gonna feel pain on the eye. So has it ever happened to you? Sometimes you strain your eye so much and you'll be like, oh, my eye really hurt right here, my eye hurt, especially if you don't have enough sleep, or for some reason you cry a lot, and there is this fluid on the eye that helps to nourish the eye. It's called aqueous humor. When this fluid is produced in excess, it can put pressure on the eye, and when it's produced also insufficient, like it can also put pressure on it. So these are some of the things that you should be looking out for. Aqueous humor. So when you visit the eye clinic, they're going to check all these things for you in order to make sure that you are within the normal range. And like I said, your pressure should be between 10 to 21 millimeters of mercury, and that gives you the normal range. So we have seen one other thing. Another thing that as a nurse I would also educate my patient on is their medication. Most of the times when the glaucoma is not at the terminal stage and you give the patient medications, they don't adhere to the regimen. They are not religious about it. They take it today, tomorrow they won't take it. They take it today, tomorrow they don't take it. And that is really bad. You are supposed to take your medications on time and at a regular intervals. Remember, you are correcting illness. You are correcting something. So it shouldn't be just when you want it. You should be able to take your medication frequently, on time, and at a regular interval. So I also educate my patient about their medication. And the medication, is it an eye drop? What is the correct way of putting on an eye drop? Now you don't let the lid of the eye drop touches your eyeball. No, that is not how we do it. It should be at a distance, at a certain distance, and then you squeeze and drop it. How many drops you're supposed to tell your patient, depending on the prescriber, the pharmacist or the doctor, what they prescribe to be the required drop that the patient has to put on. You, the nurse, has to take it and help the person. Also, I'm going to educate my patient about safety at home, since this patient is going to be affected by vision. What are some of the things the person can do in order to stay safe? Well, patient is encouraged not to drop things on the floor. Like if in their home they have a lot of wires connecting here and there, cables crossing here and there, I am going to make sure that I talk to my patient and then do some home inspection and make sure that all those safety checks are done. In the bathroom of the patient, does the patient have this accessibility, what's it called? It's not hook, like some bars to hold on to. So at the bathroom they hold on to a bar in order to shower, so that there will be no fall or trip hazards. So you look out for the safety of the patient. Is the patient bed at a low side, or what? Do the patient even have bed pads around the bed such that in case they fall, they are not going to hit their head or something? And the alarm has to be within the reach of the patient, so that the patient can easily call for help at any day and at any time. Well, these and many more is what I would tell my patient as a nurse. And then also back to glaucoma. So when this patient has been diagnosed with glaucoma, definitely the patient is going to be given some sort of assistant, are going to need some sort of assistant in the house. So we arrange for aids. If the patient doesn't have families to support them, we have to reach out to the community and ask for aid, help for the patient, in order for the patient to be able to have their ADLs done on time. Glaucoma is very dangerous. The fact that somebody's intraocular pressure is high does not necessarily mean the person has glaucoma, and the fact that the person's pressure is low does not necessarily mean the person does not have glaucoma. Earlier you detect it, the better it will be for you. So visit the hospital, visit the eye clinic, and have a routine check of your eye consistently, and that is going to help you detect it very early. Remember, it's treatable when you detect it early. But at worst case, we have certain glaucomas that are very, very complicated, that no matter what you do, the patient will go blind. But even in such instances, when it's detected early, it slows down the rate at which the patient would have been blind. It takes longer than it should have happened. So go to the eye clinic, have a routine check, and remember, glaucoma is also genetic. It's very, very genetic. So if your patient or if your parents, if you have a family history of glaucoma, my brother, my sister, don't waste time. Don't sit there and say that you are safe. You need that consistent checkup. That routine checkup is very, very, very genetic. Make sure we protect our eye. Make sure we stay safe, because you are beautiful. You are seeing me because your optic nerve has not been damaged yet. You look beautiful, and you see yourself beautiful because you have your sight. Your sight is very powerful. Do not joke with your sight. Thank you. If you like this video, like and subscribe. Leave your comment and tell me what you want me to say.